The number one biggest thing that will prevent you from healing your chronic pain and symptoms. Hi everyone, welcome back to the channel. Today I want to talk about the number one thing, the number one barrier that will prevent you from healing your chronic pain and symptoms. And for many of you listening, you're not going to like it. I'm sorry, but you're not going to like it probably. When it comes to me treating someone therapeutically, or even in my digital course, I can provide you with really fancy strategies. I have a never-ending list of strategies that I can go through with someone. Brain retraining, thoughts and beliefs, working on the nervous system, processing emotions, creating social safety. When you're working with me therapeutically, I probably have 30 to 40 sessions where we could cover something different every single time. And not that you need all of that. I want to be clear. I'm not doing 30 or 40 sessions with every person I meet with, but I do have them. And one thing that will kill your progress when you're trying to heal neuroplastic pain or symptoms using a brain and nervous system approach is avoidance. This is what it comes down to. You could use all the cognitive messages of safety you want, change your thoughts and beliefs about your body. You could start to retrain your brain, use somatic tracking, feel differently emotionally about the sensations you're experiencing within. You could process every emotional event in your life, all the trauma. You could use all the nervous system regulation, but you cannot heal if you keep your world small. What happens to people is this symptom avoidance cycle starts to take place. When I was healing, my world was really small at first. My chronic pain made my world tiny. I basically stayed in my basement suite. I never left. I barely moved. I didn't see family. There was a period of time where I was unable to work. And again, you're not to fault for this. I wasn't to fault for this. When we have agonizing symptoms, it makes sense that we start to avoid. It's similar to anxiety. We do the same thing. You feel anxiety and your response is to avoid anything and everything that could be triggering the anxiety. The same happens with our chronic pain and symptoms. Our natural response as human beings is to just avoid absolutely everything. And for anyone listening to this channel and to this video, I really empathize with you because I was there. My world became so tiny. I avoided absolutely everything I could, trying to prevent my pain from getting worse. But this symptom avoidance cycle happens where you have pain or physical symptoms, and then you have avoidance. We avoid, as I'm saying. But that avoidance actually teaches your brain, oh, there must be something really wrong with the body. And then the next time you need to do a movement, or you need to do a position, or you need to go to a social gathering, your brain feels even more in danger, and then it produces more symptoms. More symptoms, more avoidance, more symptoms. And so if you've been on this journey for a while, you're using the free content that I provide on my channel and you're not seeing progress, avoidance might be the cause. We talk about cognitive messages of safety often. Giving ourselves these cognitive messages of safety, using our evidence that, our body's not damaged, it's not permanently damaged in some way, that healing is possible. You can tell yourself this all day long, as I did. But if you don't start to use behavioral messages of safety and start to approach movements, positions, life again, you're not going to be able to heal. I can speak from experience of working with hundreds of people, and this is the number one factor that will prevent someone from healing. It doesn't matter how many sessions I have with them. It doesn't matter what techniques I use. If there isn't a willingness to slowly and gently start approaching movements, positions, life again, the brain's never going to get the message that you're actually physically safe. Even if you tell yourself with all these cognitive messages of safety, and don't get me wrong, I'm not knocking them. Cognitive messages of safety are really important. They're vital as it comes to retraining our brain to think differently, to develop different beliefs. But one of the most strong, potent ways to create a feeling of safety is these behavioral messages of safety. So for example, walking was something that I was terrified to do, because when I would walk, my back and hips within 2 to 5 minutes would be in agony. So I just started to avoid. I walked less and less. And as a result, my world shrunk greatly. Now to heal, even though I worked on my thoughts and beliefs, I needed to do the graded exposure work of starting to engage in walking again. And you want to do this slowly and gently. And it can be best to work with a practitioner in your area, because I don't know all of your individual cases. But you need to do this slowly and gently. It's not like I went from walking 2 minutes a day to walking 2 hours a day. I would have had tremendous pain flares if I had done that. But I slowly engaged in the exposure work. So at first, I would practice walking. It's hard to remember back, but it was probably anywhere from 3 to 5 minutes. And I would do the somatic work, the emotion work. I would use somatic tracking and brain retraining as I was walking, because I was trying to teach my brain, hey, you're safe to walk. Walking's not actually triggering my symptoms. We get these conditioned responses. I have a whole video on conditioned responses. I'll link to the top and how to break them. That's what I did. That's what you need to engage in to start to do this. But you get these conditioned responses where the walking wasn't causing my pain to be triggered from some physical abnormality in my body. My brain had just interpreted walking equals danger. And the more I avoided it, the more my brain learned, okay, walking really is dangerous. So I needed to start approaching. So 3 to 5 minutes a day, I would engage in this. I would send messages of safety. And I started to retrain my brain that I could actually physically walk and that it was okay. And yes, if you do this graded exposure work, you break conditioned responses, which is possible, there is going to be some pain. You're never going to do this and not have pain or physical symptoms increase, because your brain has learned to view these things as really dangerous. But you can start to break this, and over a matter of a month or two, all of a sudden I was able to walk 30 minutes, an hour. Then I started to be able to use my arms again. So for about 4 months, I did graded exposure really intensely. I had a lot of conditioned responses to break. But by the end of it, I was able to go to the gym. I was able to work out again. It was a miraculous feeling. And each step of the way, my brain was learning through these behavioral messages of safety, through me approaching movements, positions, social gatherings, starting to approach life, working again. These behavioral messages of safety were occurring, where the more I approached with gentleness and compassion and safety, the more my brain learned, hey, Tanner's body's actually physically safe. And you end up in this safety cycle, essentially, where the more I approached, the safer I felt, the more I approached. And it's a beautiful cycle to be in. That's what I'm trying to get you to all to. So check out that video on conditioned responses and how to break them. But please know, if you're on this mind-body journey, you're trying to unlearn your chronic pain, your chronic symptoms, which this channel is devoted to. I put a lot of work into it to support you and help you all for free. But if you're on that mind-body journey and you're not seeing progress, it could be a result of avoidance. We need to widen our world to teach our brain behaviorally that we are actually physically safe. And the way we do that is we approach. So please put your questions or comments down below. Hit the like button, subscribe to my channel, and I'll talk to you all soon. Take care.